Good evening, YouTube. Good evening, YouTube. This is Tammy with Fearless Living with Corey and Tammy. How's everybody doing today, this evening? I hope everybody's doing well. I just wanted to jump on for a few minutes just to give an introduction of this video that you're about to see. This is a video that I took when I was in Ghana. I went out to the Eastern region because as I've said before in previous videos that I'm doing business out there in the Eastern region. And so I went to this one particular area, Ephraim Plains, and it's in the Eastern region. It's a very underdeveloped area of Ghana, of the Eastern region. And when I was there, as soon as I hit that area, I literally thought I was in the ghetto. I mean, because it was just, the scenery was just unreal. Now, I've seen some villages in Ghana. I've been going back and forth to Ghana for the past 16 years. So I've seen some pretty rough looking villages, but I had never seen anything like this. And so I wanted to see what their healthcare system was like in that area. And so I had one of my good friends, the King, he took me over to their local clinic. And that was that's where everybody goes to. This is where everybody come if they're sick. Whether it's children, if you're having a baby, if you're having malaria, whatever the issue is, young, old, it doesn't matter. This is where you go for your health care. And it just blew me away. It blew me away. And so I just, this is going to be a 3-part series. So this is part 1. So this is the clinic that's in their local community, in that particular village. This is where they go when someone gets sick. And the bad part about it is that they don't have any electricity. So if they get sick in the nighttime or when the sun goes down, they can't go to this particular clinic for health care because they have no electricity. They have no bathroom facilities inside the clinic. It's basically a 1-room clinic. It blew me away. And because of this, I mean, I've been in healthcare 38 years. Healthcare and pharmaceutical is my background. I've 38 years retired from it. So healthcare is very near and dear to me. I believe that everybody on this God green earth deserves the right to quality healthcare. So when I saw these conditions, it literally blew me away. I mean, it just sat in my spirit. I mean, I almost wanted to cry, but I couldn't. I had to keep myself together. But I was like, Lord, there's something that I have to do. So because of that, and because of the conditions and everything, I said, I do have an NGO, a nonprofit here in the U.S., and I do have one registered in Ghana. And so what I said was that my nonprofit, one of the first projects in Ghana would be to build these folks in this community a small clinic. So this video that you're about to see, this is the particular healthcare system in this village. Now this village, this is where everybody come, whether or not you are pregnant, whether you are a child sick, or you need, immunizations, or you have malaria, it doesn't matter. Everybody comes to this one location in this area. And if it was just mind blowing to me that this is their only option in this area. The next clinic or hospital / quote unquote hospital is about 45 minutes from this location. So if they can't get treated here, they send them to the next town over, in which part 2 of the video, part 2 of this series, I did an interview with that particular area as well. So make sure you watch part 2 of this video. And so with that video, that particular clinic has limited resources. And so I will be doing things for that particular clinic as well. So I just want you to sit back, this could be a tearjerker to some people, because these living conditions these healthcare facility conditions is just unreal. I just can't even imagine getting sick, or any of my relatives, or any of my, my senior relatives getting sick. And this is their only option to go to receive some type of healthcare services. And so it's unreal. So sit back and watch this next video, and then put your comments down below, and do me a favor, like, share, subscribe to this channel, because these next 3 videos, it's a 3-part series. These next 3 videos is going to be very interesting. It just goes to show you how a lot of people are living over in Africa. And this is Ghana specifically. This is in Ghana, and this is in Afrin Plains, and this is out on the eastern region in Ghana. But just look at how, if they're sick, and if something is going wrong with them, if they have a fever, if they have malaria, or if they just need prenatal care, or if their children just need their shots, if they have a headache, anything. This is where they go for their health care. And just tell me what you think in the comments. So sit back and watch to pay attention. This is the community clinic in Afrin Plains, Ghana. Very, very, very underprivileged community here, very poor community here. So this is the clinic. This is where everybody comes to see the nurse. They don't even have an on-staff doctor. So they don't have electricity. They don't have a toilet. So this is their clinic.
Is it all right?
Yes.
The folders.
Are these like the patient charts or the patient folders?
Yeah.
Okay.
These are the folders.
And the medication.
Patient folders.
Patient
so
folders.
if you look at it, you can see the number of patients that attend the clinic.
Yes.
Every day, now and then.
And this is the patient's bed. These are the nurses.
Yeah, the nurses.
This is the clinic inside of Afrin Plains.
Yes. Afrin Plains, Mami Krobo.
Okay.
Achemfo. Yeah.
Okay. This is their clinic, a local clinic. Okay. Let's see the medications.
The few drugs that we have are packed down there.
Okay.
And it is the community that will have to source funding to buy these few drugs. Very difficult also to get money, because this is a deprived area, a farming community, where people who are here are impoverished. So it's very difficult. The nearest hospital from this place is at Dankokrom, about how many kilometers from here? More than 40 kilometers from here, Dankokrom. And so when it comes to the time for people who are not well to access medication, that is the first point where they come before they could be transferred to any other place. And they have the delivery. Do you deliver here? Yeah, because they don't have the delivery rooms and beds. It's difficult for even pregnant women to deliver here, and they have to take them sometimes in cars. They deliver in the car.
Wow.
Because they cannot access the nearest clinic or hospital where they can deliver. We have a polyclinic at a place called Kwesi, which is about 15 kilometers from here. And we will go there, then we'll have a look at the place. But if we can be able to manage the place well, where we will be able to get delivery beds and other things, the nurses here are capable to
take care of the need.
Yes.
Okay. So what's needed is like delivery beds and medication, equipment.
Yes.
Okay, so maybe I can get a list
even
of the
stand
things.
for administering
The poles for the IV.
Stand, yeah.
IV pole stand.
Yes,
okay.
yes.
And a good room too for delivery.
And so
And a good environment for delivery.
a good environment for the delivery.
Yeah.
Because we use this room for almost all the activities.
Even delivery? If
We don't do
Because of that, they
because
don't
of
deliver.
that they don't
But
deliver.
we
Yes.
take care of patients that are
Pregnant.
sick, pregnant women in the same room.
Wow.
And then we do weighing. We weigh the kids who come for their routine vaccinations also here.
Wow.
In this one room.
In this one room. Okay. Wow. Okay.
And this was our action plan for 2024. Some of the activities that we did.
Oh. Okay.
Files which they have already used and is full, and they keep here.
Okay.
You know, we should get shelves where we can arrange them beautifully.
Yes,
And
yes.
and because we do not also have enough rooms and other things are kept in the same room.
Okay.
It's become so much difficult. We decided putting up a toilet facility
Yes.
to give to the patients.
Yes.
And unfortunately, they ended up in the middle. They couldn't complete the toilet facility. Where is the toilet facility? We should go there and then have a look at it also.
Okay.
This other room is for the owner of the house.
Okay.
The first house. That's
Okay.
where he stays.
That's where
and
he
so he doesn't want us to use it.
That's fine.
Yes.
Okay, that's
He wants to. Let's go and have a look at the toilet facility. We started and we couldn't. We wanted to build this as a toilet for the patients who will be coming.
Over here where the goat is.
Where the goats is,
Okay.
yes. And we haven't been able to complete it.
Okay.
I don't know why.
Okay.
Because the owner of the facility wants to take it from us, we decided we cannot continue with doing any construction here.
Oh.
Because when we do it, he will take the house,
will take
the
it.
facility from us.
Oh,
so
wow.
yeah, we can get a small land somewhere here where we can put up this small clinic.
So we can build one here?
Yeah, we can
ourselves
build, yes.
without
Yes.
having problems
so,
with
so I'll
land?
send you to the land that I want us.
Okay.
I've given out to them so we can have a look at it.
Okay.
Get a small trade
Okay.
where we can arrange them.
So what did you all think? I mean, those conditions, what did you all think about those conditions? Can you imagine if you were sick in this area and you got sick and this was your only option to receive some type of health care? Now, what I've been told by the nurses that if someone is in labor and they don't even have delivery beds to deliver the babies, and they say they have to send them to the next town over, which is about 45 minutes away. And during the transition of them being sent from one place to the other, a lot of them die. This is what they told me. A lot of them die. They don't make it. Or they give birth and the babies don't make it. And so this is very near and dear to me because I have a healthcare background and I know what, adequate healthcare is, and everybody deserves it. It doesn't matter who you are or where you're from. Everybody deserves the right to have some type of adequate health care. So I've decided to do something myself. I've decided to, build them a clinic. I'm going to build them a clinic. So the land that you saw, the chief has donated the land. So he's going to donate the land and I'm going to build a clinic. And so I'm looking to be back in Ghana between the end of April and May. And we'll be getting started on that project. But stay tuned for part 2, because part 2, it gets more interesting because so they leave from one area. If they can't get treated in this particular area for this clinic, then they get sent to the next area, which is supposed to be like a little small mini hospital. So so make sure you look at part 2 of this series to see what their facilities look like. And so that you can see exactly what goes on, at the bigger hospital, or the more, they supposed to have it, a little bit more stuff there to be able to assist, one that's in need. But again, they have nothing as well. And so stay tuned for that particular video.